Higher risk of diabetes among South Asians starts from birth. South Asians are known to suffer from substantially higher rates of both diabetes and heart disease. A new research from the South Asian Birth Cohort study (START), published on of diabetes in the International Journal of Obesity, suggests that the risks of developing type 2 diabetes for South Asians begins immediately at birth. Researchers compared nearly 800 pregnant South Asian and white Caucasian women from Peel region and the city of Hamilton. Sonia Anand, Professor, Department of Medicine and Department of Clinical Epidemiology and Biostatistics at McMaster University, is the principal investigator. The research is significant because it suggests South Asian pregnant women should be considered high risk for gestational diabetes and routinely screened in pregnancy. South Asian women who minimize their risk of gestational diabetes and avoid excessive weight gain in pregnancy can prevent diabetes in their own children. Prevention may be an important way to break the transmission of diabetes among generations. South Asian mothers, who are smaller in stature than their white counterparts, give birth to significantly smaller babies. Those newborns has more adipose or fat tissue, termed the thin fat phenotype, and a higher waist circumference. The high amount of fat tissue is clearly influenced by South Asian ethnicity, the mother's body fat and high blood sugar levels. The research re-emphasizes the importance of diabetes prevention efforts in South Asians from very early childhood onwards, in order to reduce the eventual burden of diabetes and cardiovascular disease in South Asian adults. The START study researchers have now recruited an additional 1,000 South Asian mothers and their babies in the Greater Toronto region for further study. They are also involved in a collaborative study in Bangalore, India, where they will compare rural and urban groups, which will then be compared to Canadian urban South Asians. Researchers also intend to examine how growth in the first year of life may influence future risk of elevated glucose and other cardiovascular risk factors. Thank you.